בוקר טוב, שבוע טוב.
בוקר טוב. Welcome back.
Thank you. Thank you.
בוקר טוב.
ברוכים הנמצאים. It's a pleasure to be back. And it's also a pleasure to be able to control my own schedule and not to be noticed 12 hours in advance that I should be in Eilat in the next morning. And so that's a great improvement. I'm not sure if it's my line that it's bad, or right now I cannot see any picture, which is fine if you choose not to be on video. Anyhow, okay. So that's our 10th. That's our 10th shiur in health and halacha, according at least to my records. So we're in our 10th shiur, and Be'ezrat Hashem, as we are beginning we need to wind up. Right? Pesach seems to be far away, but it's fast approaching. It is fast approaching. We have already had Shabbat Mevarchin of Chodesh Adar, and next Shabbat would already be Rosh Chodesh, and then it's faster than what we think. So we have about 6 shiurim left in this topic before we hit the Pesach break, and after Pesach, I would like us to have something other. So we are advancing. We advance. We finished with giving birth, and now we go into a general topic of health and halacha. And in Mirza Hashem, in about 2 or 3 weeks, I would like to go to some of the main topics of end-of-life issues. So that's the basic curricula as it stands. And the topic for today, for this morning, is medical confidentiality. So secrecy, medical secrecy, and what is the commitment of a doctor or a health professional to keep the confidence and the confidentiality of information that he receives, and when he is allowed or when he's obligated maybe to break this confidentiality and give the information to someone else, maybe without the consent of the patient. So these are the basic questions we would like to speak about, and these are very regular questions. I mean, that these are things that come up almost on a daily basis by people that are working in the health professions. And I would like, in order to begin this shiur and to stimulate our thoughts on this topic, I would like to begin with presenting 4 different dilemmas that involve the question of confidentiality, and try to see, I have tried to organize them in an order. I mean, the order is that it's becoming more and more complex to know what is the right decision. So all of these questions are real questions that were asked, and we would quote the sources from which I took these questions. So let's begin. The first question is taken from, and many of the other questions we would speak about this morning is taken from the Tzitz Eliezer, Rabbi Eliezer Wallenberg. We have mentioned his name many times in this series, and that is because, as we have already said, he was the chief rabbi of Sha'arei Tzedek in Yerushalayim for many decades. So many of the questions about health and halacha reached his desk. And one of them is the following question. במקרה והרופא מוצא אצל חולה ליקוי בראייה. So we speak about an optometrist or some other eye doctor, and he detect that the patient have some deficiency in his sight, אשר לדעת הרופא עלול לגרום בתנאים מסוימים לתאונה, and that may cause, under certain circumstances, this sight deficiency may cause an accident. It can be while driving, or if the person works in heavy machine, or if he's in the army. But the bottom line is that the doctor had detected a problem that may lead to a danger to the patient or to someone else. And the patient does not want to stop, to cease from driving a car or to change his workplace. It's a very big issue. So let's say that someone is a truck driver. For the last 40 years he was a truck driver. And now his optometrist or his eye doctor reaches a conclusion that there is a problem that may prevent him from continuing driving. Now, the question is, must the doctor keep in secret the deficiency, the disease, the flaw? Or maybe, שמחויב להודיע לשלטונות המתאימים, or maybe he is obligated to inform the government, the road ministry, or the army, or the employee of the person, על מגבלות החולה. הגם שעל ידי כך יגרום אולי נזק כלכלי או חברתי לחולה. Now, who knows what damage may occur as a consequence of this information being handed over? Because he would be, so this truck driver would be, maybe he would be fired from his workplace. Who knows if he has pension? Maybe he is the only working person in his family. No one else is earning money. So who knows to what troubles are you putting him? And especially, מה אם החולה מבקש לשמור בסוד את קיום המחלה? הוא מבטיח להימנע מנהיגה. So what happens if the patient says, don't worry, I would not drive at night. I would not do things that are dangerous, but just don't inform, because then I would be completely fired. Are you allowed to take the risk to believe the patient and to take the risk and avoid informing the authorities? So that's the first question. So the first question is about a person that the doctor feels or is afraid that he became incapable of doing his work, and that may be a dangerous situation. And the question is, should he inform the authorities about this new situation? Second case, which I would like to present. And as I said, it's more complex. Meaning, even if you feel that the answer to the first case is simple, that may be more complicated. Now, the next question, I gave you the date. It's 1965, because I think that some of the data, some of the background information, I guess, would not be relevant anymore. But let's see. So that's from Rabbi Yaakov Breish, who was a Rav in Zurich, in Switzerland. And here's the following question. You got the following question. There is a certain guy, young man, 20 years old. And Rahman al-Litzlan, unfortunately, God forbid, he has cancer. Now, what is interesting in this question, says the Chelkat Yaakov, ולחולה עצמו וגם למשפחתו לא נודע כלל מזה. So the patient is not informed of his situation. Also the family. So no one knows, just the doctor. And Rabbi Yaakov Breish explains, וזה מחוקי הרופאים שלא לאמור זאת לקרובים וגם לא לחולה, בכדי שלא יכבד עליו החולת, כשיתוודע זאת לחולה. He says, that's part of the customs of the ways of the doctors, that sometimes they do not inform the patient of the grave situation that he is in because they feel that sometimes it's better not to know. And if he would know, that would put him in more dire situation. Now, I hope to be able to speak about the question of telling the truth to patients, which is also a very important and part of a larger question of the personal autonomy in the health area. I hope to discuss that maybe next week, Be'ezrat Hashem. But as for now, we will take that as given, meaning the given situation is that even the patient himself, neither his family, know about his situation, about his very dire situation. Now, the problem is that הוא נתארס לנערה בתולה ורוצה להינשא. He has a fiancé. He wants to get me. He's a 20 years old guy. He doesn't know that he maybe has a year or two to live. So he wants to get. Now the question is, I guess he just told it the doctor as a side chat. And now the question is, should the doctor tell that to the bride? Now we can imagine it's a small Jewish community. So in the end, all of them daven in the same shul. The guy, his father, the doctor, the bride, the bride father. And now the question is, should the doctor tell the bride's father that this guy is seriously sick? כי לפי דעת הרופאים לא יחיה יותר משנה או שנתיים. So according to the diagnosis, the prognosis of the doctors, then the life expectancy of this guy is no more than 1 year or two. And obviously, if the bride would know this situation, she would not marry him. So should he tell her, or maybe it's better that he'll just sit and do nothing, as long as he's not, if he would be asked, that may be another thing. But at least as long as he's not being asked, why do you have more of an obligation towards the girl than towards the guy? Right? So maybe even if the first question was clear cut to you, that you must inform the authorities, but here it's not a question of authority. There is a boy, there is a girl. You are the doctor of the boy. Would you go and tell the girl? So that's the second question. A third question, very interesting one. Usually, when we speak about children that are under 18 years old, you must inform their parents and get their consent, their agreement, consent, for any medical treatment that the child is going under. But there are certain cases in which, according to the Israeli law at least, the doctor, not only that he is not obligated to present the case to the parents, he is not allowed to do so. And one of these cases is a case of abortion. So let's say that a girl, 16 years old, comes to the clinic, and she says to the doctor, no, I am pregnant and I want an abortion. Now, I don't want right now to go into the halachot of abortion. We spoke about that in earlier shiur. When is it allowed, when it is not? Let's imagine for the sake of the matter that it is allowed. It's a situation in which it is allowed. But should the doctor inform her parents? So according to the Israeli law, no. It's not allowed. Not only that he is not obligated to inform the parents, he's not allowed to inform them, only if the girl would ask him to inform them. So that's the third question. What would the halacha say? Fourth question. Another one from the Tzitz Eliezer. A very common question. We have a patient lying in the hospital bed. It may be in any situation. And we have many of our hospitals, if it's not a private hospitals, then I think all of the hospitals in Eretz Israel, they are also have instructions within them, meaning to say that there would be students going around and the doctors, the instructors, would use the patients in order to instruct in real time, in live cases, the students. Now, when you instruct the students, you have to explain to the students exactly what is the situation of the patient. Is that allowed? Are you allowed? Because you reveal all of the secrets of the patient to the medical students around you. Is that allowed? So that's the fourth question. So again, we had 4 questions. I think that they are in, each one of them is more difficult than the one before. So we begin with the question of informing authorities about someone who is incapable of driving or performing his work. We continued to the question of the guy that had a very serious sickness, and should you tell the fiancé? That we continue. The third question was about when do you have to tell the parents about a certain treatment that their child is taking. And the fourth is the question of instruction in a hospital setting. So these are 4 questions that are related to medical confidentiality. And after we had, I hope that all of us are trying to figure out what the criteria should be, how we are to approach, what are our considerations in these questions. And as you may imagine, in the Torah, we do not find a direct instruction regarding medical secrecy. We have only the general halachot about the issur, the prohibition to tell people about information, private information relating to individuals. And that is the famous pasuk in Parashat Kedushin, לא תלך רכיל בעמך, לא תעמוד על דם רעך, אני השם. So the pasuk instructs us, לא תלך רכיל בעמך. You are not allowed to go around telling the secrets of your friend, of your fellow. לא תעמוד על דם רעך. And you're not allowed to abandon your fellow when he is, when he's bleeding, to stand on his blood. Now, this pasuk is putting one next to the other, 2 different commandments, which seems to be very, very different from one another. One is seemingly minor, revealing secrets. Well, obviously, it's not nice to reveal someone's secrets, but how can you compare it to negligence that may result in loss of life, as in לא תעמוד על דם רעך? But the Torah, nonetheless, connect these 2 into one pasuk. And from there, Hazal, and here I quote from the Rambam, had learned a very important lesson. Source Vav, המרגל בחברו עובר בלא תעשה, שנאמר, לא תלך רכיל בעמך. So if you spy on your friend, and then you pass on the information that you gathered, you had violated the mitzvah of לא תלך רכיל בעמך. ואף על פי שאין לוקים על דבר זה, and although there is no punishment in the sense of lashing on this sin, דבר זה עוון גדול הוא. Nonetheless, it's a major sin. וגורם להרוג נפשות רבות מישראל. And you should know that it may result in the death of people. So telling people secrets, it's not a minor thing. It may be very, very dangerous to them. לכך נשמח לו, that's why it's adjacent, that's why it is near, it is followed up by ולא תעמוד על דם רעך, because it's about spilling blood. זהו למד מהירה לדואג האדומי. So the story about דואג האדומי, some of you may remember, is that דואג האדומי told Shaul where David HaMelech was in the city of the Kohanim. And as a result, Shaul killed all of the Kohanim of Givon. So the mere storytelling of Doeg HaEdomi ended with the death of all of these innocent people. And what is the Rachil? Who is the one that is telling this? What is the definition of this prohibition? שטוען דברים והולך מזה לזה. So if you go to one and to the other, and you are telling stories, כך אמר פלוני, כך וכך שמעתי על פלוני, אף על פי שהוא אמת, although you are only telling the truth, הרי זה מחריב את העולם. That's a destruction, says Ram. You're destroying the world by speaking. We shouldn't speak about other people. And even worse than that, if you are telling bad things about them. Even if they are true, that is what we call lashon hara. So if these are natural things, it's called rechilut. If these are bad things, it's called lashon hara. Although all of them are true and correct. And Chachamim said, the sages had taught us, שלוש עבירות נפרעים מן האדם בעולם הזה, ואין לו חלק לעולם הבא. So there are three major sins that one will be punished for them in this world and would also lose his share to the next world, God forbid. One is idolatry, עבודת כוכבים. The second is forbidden relations, גילוי עריות. The third is bloodshed, שפיכות דמים. ולשון הרע כנגד כולם. But speaking, revealing bad things about other people, that is worse as these all three together. So that's extremely, extremely negative view of lashon hara, of bad mouthing, of speaking. And again, even if it is completely true. So that is one simple reason for medical confidentiality. That is, that the doctor is bound, as any one of us, to the laws of proper speaking. So you are not allowed to go around and speak about other people. All the more so when what you speak about are things that people see maybe as negative, as things that they wouldn't know, that the world would know about them. That's one reason. The second reason is more specific to the medical profession. And here, I would like to make a comparison with a completely different realm of halacha, but maybe not so different, and that is judgment. Dayanim, Beit Din, the court. So here is an interesting question. 3 judges, Dayanim, sit in a halachic court. 2 of them have one position, and the third has a second position. Excuse me. So as we know, they would vote, and the 2 would outvote the 1, they would outnumber the 1. So the ruling would be set as the 2 against the opinion of the 1. Now, the question is the minority opinion allowed to go out of the court and to tell the losing side, you know, I was in favor of you, but I was outvoted by my friends. So the Gemara, and here I again quote from the Rambam, Pasken, אסור לאחד מן הדיינים, כשיצא מבית דין, לומר אני הוא המזכה או המחייב, וחבריי חולקים עליי, אבל מה אעשה שהם רבו עליי? So Rambam says, you are not allowed. You are not allowed. The judge, the dayan, on the minority, is not allowed to say that he was in a dissenting view. And if he did, if he tell that he had a singular, this single view, הרי הוא בכלל הולך רכיל מגלה סוד. So he is revealing a secret that he was not allowed to reveal. ומעשה בתלמיד אחד, שהוציא דברים שנאמרו בבית המדרש, לאחר 22 שנה. So here we speak about a certain student that revealed the protocols of the court 22 years later. So you would have thought that maybe their importance had already expired. Says the Rambam, no. והוציאו בית דין מבית המדרש, you were thrown out of the study hall, והכריזו עליו, and it was announced, זה מגלה סוד הוא. He is the one that revealing secrets. He cannot be relied upon. He cannot, we cannot have confidence in him. Now, what is the reason? Why Hazal were so much against revealing the proceedings within the court? So the answer to that, again, in the Rambam is, source ח', כדי שלא ידע חייב מיהו שחייבו, כדי שיהיו הדיינים אהובים על הציבור, ולא ידע שום אדם מיהו אשר חייב ומיהו אשר זיכה. So the reasoning is for the benefit, for the integrity of the system. We don't want people to feel that they like a certain judge and they dislike another judge. For the sake of the system, we want the court decision to appear as unanimous, as completely agreed. Because even if there was a vote, but then you were outvoted, so you should accept the opinion of the majority. And you shouldn't go around and try to collect favors by telling people that, you know, I was in for you, but I was just outnumbered, outvoted. Now, we can maybe we can compare the medical profession to this question of dayanim, meaning to say that sometimes you shouldn't tell the information that reached to you, not only for the sake of the party that is before you, but as a systematic consideration for the sake of the system. Because, as explained here by Rav Zilberstein, we know שאם יגלו רופאים את סודות החולים, if doctors would go around and tell the private information being given to them by the patients, then what would happen is that many people that would want to avoid their secrets just going around within the community, so they would avoid visiting the doctor. And that would cause, obviously, pikuach nefesh, danger to life. Because if people would refrain from going to the doctor because they are afraid that their problems would get known, that's a very a very tricky business. That's a very dangerous situation, risky situation. And we know that regarding some diseases about which, for good reason or not for good reason, there are stigmas, so they are stigmatized. So for these diseases, people sometimes avoid going to the doctor. And they risk themselves, and sometimes they risk their surroundings that may get infected. So for example, checking for AIDS, that's one of the big problems that we had to deal with as a health system. Many people didn't want to go and check themselves because if they contracted it from somewhere. And if they are married, well, then that's a problem. But on the other hand, if they would not go and check themselves, then they are endangering their spouse. So that's a big question. That's a big question. And you want to keep confidentiality in order to encourage these people to come and check themselves. And after they check themselves, if chas v'chayila it's a positive answer, okay, we need to see how we convince them to share the information. But if they would know that the information would be immediately shared, they may avoid going to the check altogether. Because let's say, even if it would be a negative answer, then the question would be, why did you have to check? And the same goes for many other problems. Mental issues. People that are afraid of the stigmatization of mental issues. If they would know that going to have a check or being identified as suffering from a certain mental disease would get known in the community, maybe they would avoid coming to the doctor. Now, that's unfortunate in itself. There is such a stigma on mental health issues. But we should acknowledge that it does exist. So it is better that we would keep confidentiality. And by that, encourage people that are in need to come and check themselves and to be treated if there is a need. Being treated for addictions, many, many other areas in which we can all understand why, if we would not keep confidentiality, there is a high risk that people will just not come. So that's a systematic consideration. Again, that's not now a question of lashon hara or rechilut against the specific person you are telling about. Here we speak about a danger to the whole endeavor of public health. That's the second consideration. The third consideration that we have to weigh in is the doctor's oath. So that's a very old tradition, coming maybe from Hippocrates, which was one of the first early doctors in the Greek era, thousands of years ago. And we are being told, no, we are not now into history. Was that Hippocrates that written this oath, or maybe someone else that collected from Hippocrates' writings? It's not really very important for us. But the bottom line is that for thousands of years, in the West at least, doctors would take an oath upon receiving their credentials. And part of this oath, here it's in its Hebrew formation, shimru emunim, keep faith, la'adam she'emin bachem, to the person that put his faith in you. So someone trusted you with his information, with his private information. So you should be faithful to him. Al tegalu sodo, you should not, we must not, reveal his secret, ve'al telchu rachil. That's the Hebrew form, the Hebrew translation by a certain Professor Halperin that led the medical program in Hebrew University in its beginnings, more than 100 years ago. So that's the way that he translated that. So part of Hippocrates' oath was that one must not, the doctor must not tell the patient secrets. So you took an oath. An oath is a very serious business in Yahadut. And to the best of my understanding, that's a practice to take this oath that continues to this very day. So these are the three considerations against sharing information even in time of need. So one is the halacha of Lashon Hara. The second is the consideration of the damage to the system, that it may prevent patients from coming and sharing information. And the third consideration is the oath. Now, we would begin from the oath, because that's the easiest one. That's a very technical consideration. Obviously, we cannot go here right now into the very complicated laws of Shavuot, of oaths. But it can be said in an offhanded way that the oath to itself should not be seen to us as too great of a problem. And that is because of two major reasons. The one is that if there is an obligation to share the information, then you cannot take an oath not to share it. Because we have a rule that someone that took an oath to not do a commandment, to not perform a mitzvah, the oath is not valid. Why? Because he already took a prior oath in Har Sinai. So that's what we call in Hebrew, mushba ve'omed me'ar Sinai. He is already bound from Mount Sinai, so he cannot now bound himself to something that is contradicting. So if someone would take an oath not to eat matzah in Pesach, the oath does not take place, and he still must eat matzah. If someone would take an oath that he would not sit in Sukkah, on Sukkot, it doesn't take place, it's not valid, etc., etc., etc. So if, in a case, one is obligated to share certain information, the oath it took cannot override his obligation to share what he knows and what he needs to tell others. So that's the first very important halachic reason why the oath is not an obstacle here. The second reason is that it stands to reason that these oaths of the doctors are general guidelines. But no one taking this oath means that that is the only consideration he is making. So even if in the oath, as it is in front of us, he says that he would never break the confidence of the patient, obviously he didn't intend that, because some of the laws in the state, before even coming to halacha, require him to share information sometimes. And obviously, the doctors and the organization of doctors that make people take the oath, all of them are working within the framework, the legal framework of the state. So it can be easily said, I think, that A, this oath is not supposed to contradict prior, moral, ethical, halachic obligations. If it does contradict, then it's just not valid. So because of these two reasons, I'm not going to speak anymore about the oath. It was important for me to put it aside, but we are more interested in the first two reasonings, rationales, considerations that we put forth. One was the individual harm to the patient that you reveal his secrets. That is the issur of rechilut or lashon hara. And the second was the general problem of frightening away people from sharing information because they know that this information may be used in the future in a way that they would not consider proper. Now, there is a big difference between these two considerations. And the question, what do you put in your focus? The individual or society would mean much and may have great ramifications regarding the four questions we began with. Now, it is completely clear that while we do have an issur, prohibition, to reveal secrets and to speak lashon hara, to defame someone, all of that is completely correct. But it is also completely obvious that I am allowed to reveal secrets in order for, let's say, to save someone's life. So if you would return for a second to the first question regarding the person that has some incapacity and he doesn't see well, and he asks the doctor, please do not tell the transportation ministry that I have this eye problem. That is not a question. The doctor must go, initiate himself, approach transportation ministry and tell them that his patient is incapable of driving. Why? Because there is a danger here to the life of other people. And pikuach nefesh overrides any other consideration. So that's very simple. So it's very simple, but it's pretty simple. It's quite simple. And that's the general instruction regarding lashon hara. If I see someone that is ambushing near the road, waiting for the next victim to come, and then he would rob him. So am I allowed to tell the potential victim that is right now advances towards the ambush? Am I allowed to tell him that someone is going to attack? Of course I am allowed to tell him. I must tell him. And that is not considered as lashon hara. If it is for the sake of saving people, that is not considered lashon hara. So as long as we are speaking about pikuach nefesh, about situation of life-threatening issues, then that is, as I said, quite simple. That you would be not only allowed, but obligated to inform and to pass the information to people that would be able to prevent the danger to life. So that's the way that the Tzitz Eliezer is concluding. That's regarding, as I said, the first question that we asked. בוודאי מחויב הרופא, להודיע לשלטונות המתאימים ולמעבידו של החולה על מגבלותיו. So it is clear that the doctor must inform the authorities and the employer of the patient about his incapacities. Even if the patient asks that this information would not be handed over. Why? Because it's just too dangerous. Even if he's not being summoned to give testimony regarding the state of his patient, he needs to initiate a report, as I said earlier. And if he doesn't do that, then he is transgressing the prohibition of you shall not stand over your fellow's blood. Okay, so that's clear enough. What about the second question? There was no risk to the girl's life. She would not die because she marries someone that in himself has this diagnosis of God forbid, of very serious cancer. But on the other hand, she's going to suffer a major damage emotionally, maybe also financially. Maybe she'd find herself with a child and alone in the age of 22, 25. What would she do then? So that's a very severe damage. Not life-threatening, very severe. Now here, it's beginning to be more difficult. Because on one hand, if we speak only about the prohibition of lashon hara, then again, because it's in order to save someone from his damage, and very severe damage, then obviously it would be allowed to tell. But if we take into consideration the larger considerations of the system, of if we would begin to tell people, other people, regarding patient situation and information, then the patients may avoid sharing with us. And in the long run, that may be more dangerous. Now, I don't think there is any easy formula to balance this question. The Chelkat Yaakov himself, that we have quoted earlier, so he says, after I studied this matter somewhat, he says, נראה לפי עניות דעתי, it seems to my humble opinion, שמחויב הרופא לומר זאת לכלה. There is an obligation from the doctor's side to reveal the secret to the bride. Why? Because of the bad things that would happen if she would marry him. So she need to know. She need to know. And it's very, because it is very probable that she would remain widow after a very short period. B, even when he would still be alive, his condition would deteriorate very fast. And that may even cause damage, maybe, chas v'chalila, to a future child. So says Rabbi Yaakov Braish, the doctor in such a case must inform the bride. Now that's, just imagine the situation. That's not some authorities. There is no form for that. But the doctor is supposed to find out the bride and to tell her or to tell her parents. That's a very complicated situation. Even a more complicated one, a very similar one, but a more complicated, again from the Tzitz Eliezer. That's about a certain girl this time. We spoke about a boy, now about a girl. And it was revealed in some check that was made to her that she would not be able to give birth. And it was explained to her. But now she's going to get married, and the doctor knows that she didn't tell the boy that she cannot give birth. Should the doctor inform the boy? Now here we don't speak about questions of life and death, and they may live very happily for many years. Maybe the boy would say, fine, I would marry her anyway, and we would adopt. What is the halacha? Is the doctor allowed or maybe obligated, or maybe it is forbidden for him to share the information with the family of the boy? So the Tzitz Eliezer debates this in length, as you can see here, and he comes to the conclusion that even in such a case, you need to tell the other side. So even there is no pikuach nefesh here. There is no life-threatening situation, but it's obviously the boy would like to know, or in a reverse case, the girl would want to know before they marry that the other side is incapable of bearing children. And you as a doctor must inform him or her. Now, I didn't check and I don't know what is the Israeli law in this question. I suspect that the Israeli law would not allow someone to inform the other side in such a situation, when there is no life-threatening possibilities. But halacha, at least according to Eliezer, says that the doctor's obligation to save here the groom, the chatan, from this great sorrow when it would be revealed to him that his wife cannot bear children. This obligation to prevent this sorrow is greater than his obligation towards his patient. Now, not everyone agrees with such an expansion. So we have another opinion by Reb Asher Weiss, and he says that because of the, as we said, the more systematic consideration of our fear that if, even in such a case, we would tell the doctor to reveal the information, to expose the situation to a third party, then people would really avoid going to doctors. So if that's a life and death situation, that's one thing. But if we do not speak about life and death, says Reb Asher Weiss, we should be very wary of breaking confidentiality. So let's read it, source ט"ז. שאם לא יוכל האדם לפתוח את סגור ליבו, if a person would not be able to open up his heart to a doctor, and he would fear that the doctor would tell his secrets, reveal the information to third parties, נמצא העולם חרב לחלוטין, then the world can maybe completely be destroyed. It means that the whole health system would suffer. And in the end, there would be damage much more than the damage to this boy that is going to marry a girl that cannot give children. ולכן אין לרופא וכדומה, and for that reason, a health professional, a doctor, or maybe a psychologist, should not reveal classified medical information, אלא במצב הקרוב לפיקוח נפש. But only when you speak about real פיקוח נפש, such as the incapable driver. But if you do not speak about פיקוח נפש, or very rare cases, he says, then you are not allowed to reveal the information. And what you can do, what you should do, is try to convince the patient to tell the truth to the other side. Because in the end, these things cannot be hidden, and the price of the deception would be higher than the price of revealing the truth. That is very simple. So the doctor should try and convince the patient, but he cannot reveal himself because of our fear for the wider system. So we see here two different approaches. The approach of the Tzitz Eliezer that focuses more on the individual harm and weigh it against the individual benefit of telling, may come to the conclusion many times that it's better to tell and to break the confidence. But the approach of Reb Asher Weiss that says we must not look only at the individuals before us, but we should look at the whole health system and to ask ourselves what would be the implications and the ramifications of breaking medical confidence. and they may be very severe. So looking from a more general outlook, we would avoid breaking confidentiality even in cases in which someone may be harmed. And maybe that would be the right answer for the question of the teenager, the adolescents. So let's say this girl that came from abortion, or the boy that comes because of let's say, drug addiction. Would you tell the parents? He's 16, she's 16 years old, he's 17 years old. Would you tell the parents? So the answer may be that we would not tell, although it is, for sure, it would be preferable for both the parents and maybe even for the child that the truth would be told. And maybe we would try to convince the child to tell the truth to the parents. But we would not do it ourselves. Why? Because we do not want to close the door on the next child, on the next girl, on the next boy. So that would be Reb Osher Weiss' approach, which, again, it's a machloiket, it's a dispute here, but I find it more reasonable to my humble view. We'd finish with the fourth question, the question of the students around the patient bed in hospital. So here, it is the benefit is very simple. The benefit is that we would be able to instruct the students, and then we'd have the next generation of doctors. And if they would not be able to benefit from direct seeing of real-life cases, then we'd have our doctors in the future would be less professional, less knowledgeable. So the benefit is clear. But on the other hand, these type of cases do not present the same urgency that we saw earlier. So the Tzitz Eliezer advice to this question is that we should be given the permission of the sick person. Now, I believe that Tzitz Eliezer wrote this answer 30 years ago, 40 years ago. But I believe that in the last few years, in the hospitals here, they began to ask they don't always do that, but they are supposed to ask the patients before they bring the students. So many times they will just have you sign a general consent when you go into hospitalization that you allow them to show students. Well, that's it. But the basic point that Tzitz Eliezer brings about is that it would be more proper to ask the patient if he's interested. Now, Tzitz Eliezer advises that we as patients should agree. Why? One, because we should care about the doctors of the next generation, either for us or for our children. And B, something that is very important also, if you are chosen as a case study and students would ask questions and the doctor would have to explain to them, then there is a chance that something new would be revealed and maybe your treatment would be improved. And so it's also a benefit for the patient to be taken as an instruction example. That's an interesting approach, but he says you need to ask him. So in these 4 questions, we begin with the question of the incapacitated driver, and there we saw that it's clear to everyone that the doctor must inform the authorities. And we went through the different cases and we asked the question of should we weigh the individual harm and benefit or the more systematic damage, risk, and gain. And we finish with this question of instruction, live instruction. And here the Tzitz Eliezer says, which also seems to be a very reasonable approach, and that is that on one hand, we should ask the patient before we use him as an example, but on the other hand, we should encourage people to let the students to learn from them. And that is not only good for the students, but also for the patient himself, if maybe the consultation would yield maybe some new approaches, new ways of thought, and maybe suggestions how to improve the treatment. So that is for medical confidentiality. And Mirza Hashem, as I said, next week, I would like to speak about the subject, Be'ezrat Hashem, the subject of personal autonomy. And that is the question of to what extent should the doctor tell the patient everything about his situation, to what extent the patient should be given the opportunity or the possibility to choose his treatment. And these are questions that are undergoing revision and change in the last decades in the medical profession. So I would like, Be'ezrat Hashem, to try and see with you what is the halachic approach to these type of questions. Thank you very much, and have a wonderful week.
תודה. שבוע טוב.
שבוע טוב.
Thank you.
שבוע טוב, thank you, Ralph.
שבוע טוב, ביי ביי.
תודה.